Go ahead.
Alright, so I pull the privacy curtain as I walk in. Hi, my name's Eddie. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Brian Erb, 10/22/95.
Okay. I would check his medical little bracelet if you had one. And can you tell me if you have any known allergies?
Nope, just cats.
Alright. Alright, and wash my hands, put on my gloves. And can you tell me what the year is?
It is 2019.
2019. Alright. Can you tell me who the current president is?
Trip,
Okay, and can you tell me where you are?
Weatherford College Hospital.
Okay. Do you use any assistive devices such as a cane or a walker?
No,
Do you use oxygen at home?
I do not.
Okay. And do you have any known ostomies or injuries that I need to know about or open wounds?
Not that I know of.
All right. All right. So the first thing I'm going to do is I'm going to test your cranial nerves. So starting with number 1, this is the olfactory nerve. So it's going to be smell. So you can close your eyes for me. And can identify this smell for me.
Alcohol.
Yeah. Very good. All right. So that's the first nerve and is intact. Second nerve has to do with eyesight. So we're going to take our handy dandy little chart here. I would normally hold it 20 feet away and ask him to read it for me. Can you tell me what that says?
E, B, F.
All right. Very good. So cranial nerve 2 is intact. So the next one are kind of paired together. So we're going to do 3, 4, and 6, which is the oculomotor, the trochlear, and abducens. All right. So the way we're going to test this is I'm going to have you first off. I'm going to check your EOMS, which is follow this into my pen with your eyes, just your eyes alone. And I'm just going to check the dilation of your pupils. So look straight up. All right. So cranial nerve 3, 4, and 6 are intact. All right. So next we're going to go to 5, which is the trigeminal nerve. All right. So I'm going to have you clench your jaw for me. Good. And can you close your eyes? And I'm going to touch different parts of your face, and just let me know which part I'm touching.
Chin, forehead, cheek.
All right, very good. All right, so cranial nerve 5 is intact. So number 7 is the facial nerve. So I'm just going to have you go ahead and just smile for me. All right, and frown. Can you puff out your cheeks? All right, and then can you just raise your eyebrows for me? All right. There's no difference in either side, so cranial nerve 7 is intact. All right, so cranial nerve 8 is the vestibulocochlear, which has to do with the ears. All right, so first off, I'm just going to go ahead and get behind you. So here, go ahead and stand up for me. Turn around. All right, so I'm going to make sounds on left or right, and just tell me which side you hear it from.
Right,
Okay.
left,
All right. And now I'm going to whisper to one side or the other, and tell me which side you hear it on, and repeat it back to me.
right, 1, 1, 2, 3. Left, A, B, C.
All right, very good. Sit down. All right. So 9 and 10 are the next nerves we're going to test, and then the glossopharyngeal and the vagus nerve. All right. So can you go ahead and swallow for me? Good. And can you stick out your tongue? Very good. All right. So cranial nerves 9 and 10 are intact. So the next one is number 11, which is spinal accessory. So I need you to go ahead and push against my hands with your shoulders. Good. And I'm going to put my hand on either side of your face. I just need you to press against them. Good. Good. All right. So cranial nerve 11 is intact. All right. And the last nerve that we're testing is the hypoglossal. So this one is, I'm just going to have the patient repeat back to me. So repeat back to me, light, tight, dynamite.
Light, tight, dynamite.
Very good. All right. So cranial nerve 12 is intact. Now we're going to proceed on to the rest of the exam. So I'm going to check the head for any sort of redness, any lesions, any infestation. Nothing there. The hair is evenly distributed. Facial features are symmetrical, as well as the ears. Right. No sign of swelling, no exudate.
Sorry.
either side. Alright, so can you look straight up for me? Check the nose. Okay. No redness, no swelling, and no lesions. Alright, and last but not least, open up your mouth for me. Okay, stick out your tongue, say ah. Okay. Alright. So no lesions on the inside. Teeth look very good. And last but not least, just gonna go ahead just look straight ahead for me. Sclera sclera is pink and moist. Alright, and I'm just gonna check your thyroid. Not swollen, lymph nodes. Non-inflamed, non-palpable. Alright, and then can you look this way for me? Okay, and the other way. No jugular venous distension. And then I'm just going to listen to your carotid artery. So you can do the same thing for me? Okay, other side. So no bruits and no jugular venous distension. All right, so now we're going to move on to the chest. I would examine his front and back, checking the thoracic cavity to make sure there's no disfigurements of any kind, which yield to it. All right, so next I'm going to listen to your breath sounds, starting in the front. All right, so as soon as I put my stethoscope down, please breathe in and out. Yeah.
And I actually put this out yesterday.
Alright, so and then on the back.
I walk myself through.
Alright. Alright. Can you breathe in for me? Alright. Lungs inflating evenly. No unlabored breathing. No cramping, no wheezing. And no accessory muscle use. Alright, so next I'm going to listen to your heart. So first bottom listen to is the aortic valve. Aortic. Second one's the pulmonic. Third one's the Erb's point. Then tricuspid. And last one's the mitral. I'm going to stay here and listen for 60 seconds, listening to the heart at the PMI. Okay. Heart sounds good. Non-threading, non-bounding, even rhythm. Alright, so next I'm just going to look at your skin. Alright, so it is cool and dry. Hair distribution is even. There's no sign of edema. Can you give me your fingers? Testing for capillary refill, which is less than 3 seconds bilaterally. No sign of clubbing. Okay, and then do the same for the feet. Pedal pulses are unthready, unbounding, just like the radial pulses. Okay. Hair distribution is also even on legs and no sign of edema. Okay. All right. So next, I'm going to go ahead and have you, and then also one last thing before I do that, test your skin turgor. Okay. Looks good. No tinting. All right. Can you go ahead and stand up for me? All right. So next, I'm just going to have you walk to here for me, just normally. Okay. And heel toe on the way back. All right, looking good. All right, so gait looks good. All right, and balance. All right, so we're gonna test your range of motion next. So if you can go ahead and take your hands for me, just do this. Good, and then just. Okay. And then windmill for me if you can. And the other hand. And straight up. Okay. Alright, and then toes up and down. There you go. Other hand, or other foot. Alright, good. Alright. And then go ahead and sit down for me one more time. Alright, so next we're going to test your strength on your sides. So wherever I put my hands, just push against them. Alright, so forward, back, up, down, yeah, up. Down. Okay. Thighs up, down, forward, back, up, down. All right. So you're gonna lay down for me. All right. So I'm gonna go ahead and ask you about your last bowel movement. Do you know when it was?
This morning.
This morning? All right. Can you tell me the color?
Brown.
Brown. Consistency?
Soft form.
Soft form? All right. And any unusual odors?
Just good odor.
Just good. All right. All right. So I would look at the abdomen before touching it, checking to make sure there's no obvious distension. If there's none, then I can go ahead and proceed with listening in the 4 quadrants. Normal bowel sounds, hear the twinkle, which is what we're looking for. Alright, next I can palpate all 4 quadrants, checking for any sort of tenderness. And let me know if you if you feel any tenderness. Also looking for it's firm, to make sure it's not firm. Alright. So, none of those were present, which is good. So next I'm going to look at the bladder to make sure it's not obviously distended. If I don't see any distension, I can palpate to make sure it's not palpable. Right. And then I would ask the patient about their last urination. So when was the last time you went to the restroom? Went to pee?
30 minutes ago.
30 minutes ago? What was the color?
Yellow.
Yellow. What was the clarity?
It was good.
Very clear. Right. What was the odor?
Didn't have an odor.
Okay. Any unusual frequency with how often you've been going lately?
Nothing unusual.
Do you have the urge to go after you finished going? Okay. All right. That should be it. All right. Hand hygiene. All right. Do you need anything else before I leave?
Good.
All right. Here's your call lights. If you need anything, don't hesitate to call us.